Presenting TFM. The most happening music, the most important news, and most importantly, your views. At times of Oman radio station. TFM. Let's talk.
Live on TFM and the TFM Facebook page. This is the live feed of TTV. Let's talk.
Hello and welcome to the Midday Update. These are the breaking news stories. The Ministry of Health today announced the registration of 6 new COVID-19 deaths in Oman. The death toll has now touched 169 in Oman due to the virus so far, the officials at the ministry informed. They have also extended their deepest condolences to the families of the deceased. The Ministry of Health announced the registration of 910 new COVID-19 cases in Oman on Monday. Amongst the new cases, 375 new cases were of non-Omanis and 535 were Omanis. The total cases in the country has now touched 39,060, which includes 22,422 recoveries and 169 deaths, according to the Ministry of Health. The ministry urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health, as well as staying at home and not going out unless necessary. Those were the COVID-19 updates. We'll take a short commercial break and we'll be right back. Welcome back to the Midday Update. The Ministry of Agriculture and Fisheries has reopened Al Seeb Fish Market after a 3-month lockdown due to the outbreak of COVID-19. Ibrahim bin Abdullah Al Kartoubi, Director of Fisheries Department in the Vilayat of Al Seeb, said that for the time being, only 30% of the market's capacity will be utilized, which means only fishermen, salesmen, fish cutters, and inhabitants of the Vilayat of Al Seeb will be allowed to frequent the market. Indian nationals in Oman can now choose the flight on which they wish to travel home during Phase 4 of the Vande Bharat mission. Those interested need to visit the Embassy of India and Muscat's social media pages, where a form has been uploaded for them to fill in. Before making clear their preferences for these flights, they also have to register with the Indian Embassy their intent to fly home, which requires them to fill in the same repatriation request form that all Indian nationals in Oman who wish to travel home have submitted. Firefighters were called to the Kurram-Darset highway to attend to a vehicle that had caught fire on the road. A statement from the Public Authority for Civil Defence and Ambulance said the fire department in the Governorate of Muscat managed to control a fire on the Kurram-Darset road in Vilayat Matra with no injuries reported. Public Authority for Civil Defence and Ambulance called on motorists to periodically check their vehicles and send them for maintenance and asked them to take the necessary precautions required to avoid fire accidents in them. Oman will launch on July 1st a new tax card system that will serve as proof of registration of a taxpayer with the tax authority. To cost OMR 10, it will be valid for 2 years from the date of issue. All ministries, public authorities and institutions and companies having more than 40% state holding must request the taxpayer to submit a copy of the card when issuing any contracts or direct undertaking any transaction with the taxpayer. The chairman of the tax authority may impose a fine in the event of failure to obtain the tax card. Every taxpayer must apply to obtain the tax card when initiating the incorporation or licensing procedures for practicing the activity or registration in the commercial or industrial registry and shall request for renewal upon the end of validity of the card. Tax card will replace the tax certificate currently in use at the authority that is required by some government authorities except in cases where the tax certificate is requested for the purpose of cancelling a commercial registry, dissolution, merger or liquidation of a company. Passengers will not be allowed to pass through security checks at the Muscat International Airport unless they are wearing masks as a precaution to avoid the spread of COVID-19. In an advisory issued by Oman Airports, the company managing the airports in Muscat as well as other parts of the country, passengers were also asked to limit the number of hand baggage they carried with them so as to avoid overcrowding and to keep lines moving smoothly. The instructions were issued as part of the procedures put in place by Oman Airports ahead of reopening the Muscat International Airport to commercial flights. Currently, only scheduled repatriation flights are allowed to land at the airport when it comes to passenger aircraft. As part of the procedures at checkpoints in the airport, Oman airports will provide hand sanitizer and disinfection products prior to passengers and staff screening checkpoints. Measures also include limitation of carrying handbag to avoid crowded situations at the staff screening points and maintaining physical distancing for both passengers and staff. Security staff will not handle the passengers unless they wear proper masks. Markings have been established on the ground within the queuing area to indicate proper distancing. Other steps include the availability of dedicated staff to guide and manage the queue at screening points. The rearranging of security checkpoint accesses and layouts will be taken into consideration for the future. Staff and crew must also not pass through the same CSP reserved for passengers. Signage shall highlight the need for passenger cooperation throughout the screening process. Disinfection will be conducted frequently for touched or exposed surfaces and security screening equipment, which includes trays. Those were all the news stories. We'll be back after a short commercial break. Welcome back to the Midday Update. Today we are addressing a very important dental concern, and that's wisdom teeth. Everything that you need to know about it. We're going to be joined by two experts. That's Dr. Norma and Naser, who is a general dentist at the Essa Dental Center, and also Dr. Zainab Fadli, who is a general dentist at Essa Dental Center. We'll speak to Dr. Zainab first before we move to Dr. Norma. Dr. Zainab, welcome to the show.
Hello, thank you. Thank you for having me.
Dr. Zainab, we will get to the basics first for people who want to understand wisdom teeth and the complications associated with it. So tell me, what are wisdom teeth?
Wisdom teeth, they are generally the last teeth to erupt in the mouth. They formally called as third molars. They are actually based at and localized at the back of the mouth. The last teeth to erupt also.
Right, and at what age do people generally get their wisdom teeth?
Generally, wisdom teeth, they actually erupt sometimes at preteens or late 20s, or sometimes they erupt early as an older adult, and the age range it starts from 17 till 25 years old.
Right. And doctor, I understand the cases are rare, but have you seen any teens or preteens who have had wisdom teeth? As you mentioned, sometimes it happens early. How do you manage them? Because of course they are younger. Are there any specific challenges associated to that?
Usually there are no challenges if they are not causing any symptoms or any complaints to the patients. Usually if they are positioned well, if there is no complication with their eruption, if they are not causing any kind of discomfort or any complication, repeated kind of discomfort to the patient, usually we keep them erupt in their own correct time.
And does everyone get wisdom teeth? Is it something that we can avoid? I guess not, but what do you have to say?
No, not everyone can get all their wisdom teeth. Actually, it's 30% of the population, they don't have any wisdom teeth. Some people have 4 of them. Some people have 3, 2, or 1 of them only.
But you will still get at least 1. That's unavoidable, right?
Not necessarily. Some people, they have it totally absent. They don't have any of their wisdom teeth, not impacted, not erupted. They're just missing.
That's a possibility that we weren't aware of. Now, Dr. Zainab, can you tell me, why are they removed then in that case?
We actually remove them once they start causing symptoms, or when they are impacted, as they say. There are many reasons for why we remove them. Either they are impacted, which it means that they are trapped into the jawbone or the gums, or they are malpositioned, they are in a wrong angle due to crowding of the teeth, or they are cavitated and the patient cannot keep them clean because due to difficulty to access them, he cannot brush them, he cannot floss them, or if the mouth is too small and there is no enough space for the tooth to erupt.
And does that mean just because you've taken out one wisdom tooth, does it mean that you have to take out all of them? Is there a connection? Is there a link? Or do you just take out the ones that have a complication or a problem?
Yeah, not necessarily we remove them all, that we have to remove them all. We usually start with the one that have the most symptoms or the most complication to the patient, so we can relieve him. If he wishes to extract them all, that's a possible. We can do that, or you can do.
That's a personal choice.
Yes, it's a personal choice. But first, of course, it's under the medical consultation. We have to examine the tooth to see which one needs to be extracted first, and it depends on the case. Actually, there is no specific rule for that.
Doctor, we've heard this term a lot. That's impacted wisdom tooth. Can you tell me about that?
Impacted wisdom tooth, that means that the tooth failed to erupt or develop in their correct position after the second molar has erupted. So they actually stay under their level.
And are there any specific symptoms that a patient might experience?
There are many symptoms, but the main is the pain, toothache, and the pain can start from the lower jaw and radiates to the side of the face. He can also have numbness, headache, limited mouth opening. He cannot open his mouth to the normal range. Bad breath, unpleasant taste after eating, swollen in the lymph nodes in the side of the neck, and headache.
Doctor, if I could ask you one last question before you go. As a dentist, what is the hardest case that you have tackled?
The hardest cases, if related, of course, related to extraction of the wisdom teeth. We cannot say it's the hardest, but it's challenging, and each case has its own challenges. And there are many things that we have to consider before going into such surgeries.
And how often do you think people should visit their dentist? Is there a recommended time where they should keep coming back and doing regular checks, just like we have checks for our body?
Yeah, for checkups, it's advised actually for the patient to come every 6 months for a regular checkup and regular cleaning as well, to discover any new complications that he have, any new complaints, and new cavities, and so on. Of course, and keep on with the with the oral health advices.
Perfect, Dr. Zainab. Thank you so much for that. We'll be speaking to Dr. Norma after this, and we have a lot more questions. We have a couple of questions coming from the audience too. So we'll take a short commercial break and then we'll get back to Dr. Norma. Hello and welcome back to the Midday Update. We were speaking to Dr. Zainab about wisdom teeth, and she gave us some facts, some things which we didn't know. And now we have Dr. Norma, and we also have a lot of questions from the audience. So we're just going to start with a few questions with Dr. Norma now. Dr. Norma, welcome to the show.
Thank you.
It's a pleasure to have you with us as always.
Thank you for having us. Thank you so much.
So we addressed a few fundamentals of wisdom teeth. Now we'll get back to some things which are slightly more complicated. Can you tell me what are some problems that can arise if we do not remove the wisdom teeth?
Now, wisdom teeth, if they don't grow properly, they will cause several problems. They might cause problems in the adjacent teeth. They might cause problem in the jaw itself. They also might cause infected or inflamed gum. Sometimes it will lead to alignment problem. Sometimes it will lead to sinus problems also, and it will lead to cavities in the adjacent teeth. Now, if you decided to delay the extraction procedure, then this complication will come more. It will be more difficult to interfere then. Maybe the adjacent teeth cavities will no longer be able to repair it. Usually we advise the patient not to delay the extraction, because with time the formation of the wisdom tooth will complete. The roots will become longer. So the extraction will be much more difficult. Also, when you're getting older, the bone density will be higher. This high bone density will make it more difficult to remove the tooth. In younger individuals, the healing process is much easier and the complication is considerably much less. Now, if after all these reasons the patient still insists not to do the extraction or delay it, he has to agree to a long-term plan of following up this tooth, monitoring it with the doctor. He has to come for regular checkups, x-rays, and he has to follow strict oral hygiene measures to keep that area clean and prevent further complication.
Doctor, following on what you just said, we had a question that's come in.
Yes.
What are the permanent damages that can happen if you don't take off the wisdom tooth? Because from what I'm reading from the comment that we've received on Facebook is that sometimes the wisdom tooth, it pushes the other teeth. It has some kind of an impact which ruins the alignment of the other teeth, and this is a damage that is irreversible.
Actually, the alignment thing, it's not approved, like nothing scientific. They come at an age where the lower teeth start to get more crowded. This is a process that will happen with age. We cannot avoid it. So the people usually relate it to the wisdom teeth. But usually the problems that we're talking about are caries to the adjacent teeth that might reach to root canal and damage the adjacent teeth. Sometimes it will be cysts in the bone, permanent damage even to the nerve inside your bone. So these are the more important complication, let's say, not the alignment itself.
Right. And doctor, why is it harder to, or let me rephrase it, is it harder to remove a wisdom tooth as compared to any other?
Yes, definitely. It's much difficult. We have variety of factors. First of all, the position of the wisdom tooth is at the angle of the mouth. There, the bone is dense. We have teeth that are already inside the jaw. Sometimes there is no place for it to erupt, as Dr. Zainab mentioned. So whenever we're removing it, in some cases, we have to cut it in small pieces. Then only we can extract it. If it's also covered by gum, we have to start with an incision to expose the tooth, then we will continue the extraction. The most thing that we have to pay attention for is the anatomy of the wisdom tooth itself. So the roots are usually have like a variety of shapes, form. If the roots are fused or separate, if they're fused, the extraction will be difficult. If they are separate, it will be much easier. Also, if the roots are curved long, then they might tend to fracture while doing the extraction, and this will complicate our procedure.
Another complication that you did speak about earlier, doctor, is the possibility of nerve damage. Is there anything that you can do to minimize this risk?
Of course, like as I mentioned, if you remove it earlier, like when it's recently come in your mouth, then the possibility of the nerve damage will be less, because the nerve is usually located at the angle of the mandible. So if the tooth is not completely formed, it will be far away from the nerve. But with time, the formation of the root will complete, and then it will be very close to the nerve.
And after the extraction is done, what do you recommend as the ideal recovery period? How long do you think it usually takes, and how long should people be careful?
It varies from 7 to 10 days, and of course it depends on the patient himself and on the procedure itself. So some people will take much less time to recover, and some people will take longer period to recover. But usually 7 to 10 days as maximum. You might need to consider taking few days off work, from 1 to 3 days maximum, whatever the doctor advised you, just to have some rest and allow healing to happen. But usually in the upper wisdom teeth, it's much easier, the extraction is easier, and the healing is faster.
And are there any complications that can arise once the extraction is done?
Of course, with any extraction there is complication, but with wisdom teeth it's much more. We expect damage to the gum or the socket around the tooth which we removed. There will be bleeding, there will be swelling for some time. There will be discomfort as general, yani, and sometimes the patient will have difficulty in opening the mouth because in the surgery he opened the mouth for some quite long time. So there will be muscle spasm that will be there for some period of time. Also, as we mentioned, if the tooth is close to the nerve, then there might be numbness in the lip, in the tongue, or in the mouth that will stay. Not necessarily it will go directly after the extraction. It could stay for a few months, but usually it's a temporary problem.
So, doctor, the numbness can actually...
And also we have... Sorry, yeah, you can ask.
No, go ahead.
Yeah, I wanted to say, that and the most common cause or complication is a dry socket, that we will talk about it in a bit.
Yes, doctor, could you tell us more about the dry socket? Because that's also a term that's frequently used.
Yes, it's a very common, let's say, term that we hear. Usually when we extract the tooth, there will be a hole in the bone. So this is basically the socket. This hole will be filled with a blood clot. The blood will produce it directly after the extraction. So this blood clot will cover the bone and the nerve underneath. The problem happens when this blood clot, for some reason, is dislodged from its place. So the bone and the nerve will be exposed. It will be very sensitive, exposed to fluid, to air, to food, and there will be infection in the area that we call a dry socket. Dry socket, it's very popular because it's a very common problem. It happens in smoker. It happens in patients with history of dry sockets in previous extraction, women who are taking birth control pills. Also, if the patient has poor oral hygiene, if the extraction itself was difficult or complicated, it will increase. The problem in the dry socket, it will lead to very severe pain. It will happen 3 to 4 days after the extraction. It needs 7 to 10 days to heal, but the pain sometimes will be very severe, unbearable. It might be even worse than the pain that was before from the tooth itself. So usually the patient has to go back to his dentist. He will clean the area. He will put a dressing there just to decrease discomfort until the healing process happens by itself. Also, we have to stress that if you don't follow the instruction after the extraction, there's a high possibility to have a blood or a dry socket. So the doctor will advise you not to gargle, not to rinse, not to use a straw after extraction, just to try to keep the blood clot in its place. If you don't follow these instructions, if you smoked, if you had alcohol, then the blood clot will be dislodged and you will end up having severe pain that sometimes is not even relieved by painkillers.
So essentially, you've got a dry socket if there is unbearable pain, and that's when you need to get back to your dentist.
Yes, actually, we call the patient second day of extraction just to check on him, but the dry socket will start 3 to 4 days. So in most of the cases, he will call us. He'll say, I was just fine, then suddenly I had a severe pain. Right. So directly we'll tell him to come, we'll clean the area properly and put a dressing just to cover the exposed bone. So it will heal by itself. But the problem is, in that process, if the bone is still exposed, the patient will have severe pain.
Right. Doctor, in an earlier question, you also mentioned numbness. So we've got a question come in that you mentioned the numbness could last for several months. And you also mentioned muscle spasm. Yes. How long does muscle spasm last?
Muscle spasm usually, let's say maximum, it's for 1 week. This is due to the to opening for a long time in the surgery, or if the patient is tense, for example, he will open for 45 minutes. He will have this muscle spasm. We'll just advise him to put cold packs and from the second day warm packs to relieve it. Within 1 week, it will be gone. But the bigger problem is the numbness. Sometimes we cannot avoid, like we do the extraction, we tell the patient your tooth is very close to the nerve that is supplying your jaw or mandible, so there is a possibility of a damage to the nerve. Usually, or most of the cases, is a temporary damage. Within 5 to 6 months, it will be gone. Sometimes we give the patient's vitamins to decrease the effect and make it heal quickly. But in some rare cases, it is possible to have a permanent damage in the nerve. So the patient will have continuous anesthesia or paresthesia, let's say, loss of sensation in the lips, in the tongue, in the mouth, in the area, like on the side which we remove the wisdom tooth from.
Correct, correct. Doctor, so I believe a lot of people are actually quite frightened by the thought of tooth extraction from the comments that I'm getting. The other question that I have here is, can I go in for tooth extraction under sedation?
Yes. Some people say are too scared to undergo the regular procedure, which is by LA, local anesthesia, while you are awake. So some patients will ask the doctor to give them more anesthesia, not the regular anesthesia. So we go for the sedation. Sedation, you will be given some medicines. It will help you to relax more. You will not actually remember what happened exactly. But we usually don't go for sedation for removing one tooth. So if we decided to take the patient to sedation, then we can consider removing all 4 wisdom together, or maybe 3 of them.
All right. So I think the patient might actually consider removing all 4 of them together if they're too scared, because they'll be under sedation. And the experience won't be that traumatizing.
Yes. I had my 4 wisdoms removed in one session. My doctor advised me to go to sedation. Then we scheduled it for sedation, but then he told me like he think I can do it. So yeah, we removed the 4 in one session. It was very simple. It took half an hour to remove 4 of them, and I was awake in the entire procedure.
That's good to hear. That's good to hear. Doctor, we've got another question.
Yes,
Some people...
Yes.
So you were saying?
I was saying there's no need to be scared. Most of the cases there will be no problems. The problem when you ignore it because you're scared and you don't go to the dentist, then whenever you go, let's say the problem will be bigger. You have to go whenever you feel a slight symptom of what Dr. Zainab mentioned, of swelling, bleeding, discomfort, inability to open the mouth.
Well, you've heard it from the doctor herself. There is no need to fear the dentist. If you experience pain, just go ahead, speak to your dentist, and they will take care of it. Doctor, I've just got one more question before we go. You did mention about rinsing your mouth, or of course we don't recommend anyone to smoke or drink alcohol, but even brushing techniques after tooth extraction. There is also another thing that we've got a comment here on, which says about workouts. Is tooth extraction and workouts linked in any way? Doctor, can you hear us? We were just speaking to Dr. Norma about tooth extraction, wisdom tooth extraction. We went over some really good questions. We had a lot of comments from our audience also. Of course, the thought of getting your tooth pulled out is a little scary for some people. We had questions on if we could undergo tooth extraction under sedation, and as Dr. Norma said, if it's just for a single tooth, maybe the doctor wouldn't recommend, but of course if you're taking out all 4 of your wisdom teeth, then this is something that they would consider. We were also speaking to her about nerve damage and other complications that can arise during the complications, but what's more, but you're safe, you're in the doctor's hand when you're doing the tooth extraction, but however, there are certain protocols, certain rules that you do have to maintain even after the extraction. So let's get back to Dr. Norma. We've got one more question for her from the audience, so I don't want to miss this out. Dr. Norma, I was asking you, you mentioned rinsing your mouth, brushing techniques after tooth extraction. What about workout? Is workout anyway linked to tooth extraction? Should you work out? Is there a gap? Is there a period where you should not work out? How can it affect tooth extraction, if it all can? All right, so we're going to wait for Dr. Norma to answer that question. So my question was that there are certain procedures that you do, there are certain protocols that you follow after your tooth extraction is done. One of them is not rinsing your mouth too much, not gargling, as Dr. Norma mentioned. Of course, we do not recommend smoking or consumption of alcohol, but this is something that can actually aggravate the situation. She also mentioned about dry sockets, which could be a problem among smokers. And now we just want to, we were also talking about a question that one of our viewers asked is numbness and muscle spasm. Something that Dr. Norma mentioned, which is quite interesting, is that numbness is something that can last, which happens near your lip, your jaw. Numbness can last for a pretty long time, which can go on to a couple of months even. But yes, Dr. Norma did mention to us why it happens and what we can do to prevent that from happening. So we've got Dr. Norma back online with us. She's on the phone. So my final question to you, Dr. Norma, workouts, is it linked to tooth extraction? Is there a time period that we should not work out? Because for most of us, we think it's completely two different things. It's workout and tooth. How could they possibly be related? But we'll get a dentist take on that, doctor. So why don't you tell us?
Usually we advise the patient on the day of extraction not to do any heavy workout. He has to rest. We don't want the blood flow to be very high. We want him to have some rest. We want to decrease the blood flow to the extraction area. So we don't recommend any very heavy, let's say, workouts. Sometimes if the extraction was really difficult and surgical, we might even ask him to have rest for 3 days.
3 days.
Yeah, so there's no need to rush to do the sport. If like normal walking or jogging, it's fine. But any heavy workout is definitely not recommended.
So it is true then, no workout for at least 3 days, no heavy workouts for 3 days after your tooth extraction.
And the first day, definitely no.
Definitely
and
not the
other
first
days,
day.
if the extraction is simple, then we can consider it. But in some cases, of course, no, we cannot allow the patient to go and do heavy workouts.
Perfect, Dr. Norma. I think we've answered all our viewers' questions. Hopefully we have. And I'd like to thank you once again for coming on the show with us. You gave us some really, really good, insightful information. We hope to have you back again soon.
Inshallah. Thank you for having me, and we're ready at any time. Thank you.
Thank you so much, doctor.
Thank you. Bye-bye.
Well, that was Dr. Zainab and Dr. Norma from Alisa Dental Center. We're going to be back here tomorrow at the same time to discuss more news and with new guests. So stay tuned to TTV.
You're my kind